Good evening, students. Today I will discuss one of the important part of the oral and practical examination, and that one is the radiology part. In radiology, today I will discuss some of the X-rays of head neck region. And you know, to describe one X-ray, we must mention the region of the X-ray, whether it is a region of the head neck or region of the upper limb or lower limb. And second one is the view, whether it is anterior-posterior view or posterior view or lateral view. And then we have to describe the particular X-ray given. I will show you one by one. I will describe the different views of X-rays of head neck region. Let us see the X-rays. This is one X-ray of the skull, and the view is lateral view. So it is the plain X-ray of the skull, lateral view. Then what are the things we can see in this X-ray? We can see there are some dense area or white areas called radio-opaque areas, and there are some black areas which are radiolucent areas. We will know what are these radio-opaque areas and what are the radiolucent areas. Let us first discuss the radio-opaque areas. Yes, this is the skull or vault of the skull, you know, and this is anterior side, it is posterior side. So the frontal bone you can see here, followed by parietal bone and posteriorly occipital bone. And here the suture will be the sagittal suture. And other radio-opaque areas are here, some part of the neck, it is visible, and all these are cervical vertebra. And if you see the cervical vertebra, this is the first cervical vertebra, then second, third, fourth, fifth, sixth, and the last one will be 7. And in the first cervical vertebra, this is the spine. All these are spine of cervical vertebra, and these are all the bodies of the cervical vertebra, and here is the anterior arch of the atlas or first cervical vertebra. And other radio-opaque areas are, here is the hard palate, here is the teeth from the upper jaw, teeth of the lower jaw, and the shadow of the mandible, and here this shadow is the mastoid process of the temporal bone, and here is the radio-opaque areas of the frontal bone. So these are the main radio-opaque areas we can see. Then what are the radiolucent areas? Here one radiolucent area you can see here, here another radiolucent area, here another black areas means contain air. Now we have to know what are these areas. Among the radio-opaque areas, first of all, I told you the sagittal suture. I also told you the different cervical vertebra, their bodies and the spines, and between the bodies there are intervertebral disc. And this is the anterior arch of the atlas or first cervical vertebra. And this is the shadow of the mandible. And this is the shadow. So the two shadows are there. One shadow is this one, and another is this one, lower border. So this is the mandible of this side, and this is the mandible of the opposite side. And if you trace it upwards, you can see this is the condyle of the mandible or head of the mandible. Here it articulates with the temporal bone. Mandibular fossa of temporal bone is this one. So this region is a temporomandibular joint. If you are asked what is this joint, your answer will be the temporomandibular joint. How it is formed? It is formed by the condyle of the mandible and the mandibular fossa of the temporal bone. What type of joint it is? It is condylar type of synovial joint. And if you trace this shadow downwards, here you will get an angle. This angle is the angle of mandible, which is found by the posterior border of the ramus and inferior border of the ramus of the mandible. So this angle is found both by the part of the ramus, not by the body. And this is another shadow of the mandible of opposite side. This is the angle of mandible of that side. And this is the body of the mandible, and here the tooth of the lower jaw. And this radio opaque area is the hard palate, this one, followed by this soft tissue here. It is a soft palate. How the hard palate is formed? The hard palate, this one, it is found by two bones. One is maxilla and another one is the palatine bone. Anteriorly, the hard palate is formed by the palatine process of maxilla both sides, and posteriorly the hard palate is formed by the horizontal process of palatine bone of both sides. So the hard palate formed by these two bones, and behind this hanging part is the soft palate, which is formed by the different muscles, 5 pairs of muscles, with the covered mucous membrane of the nasal side and mucous membrane of the oral side. Then if we go upwards, here we can see this is the radiolucent area, and around this is a frontal bone, and below this concavity is due to the orbit. I will show you in another view the orbit and the frontal air sinus in a more clear view. I will show you. And here in the upper part, here is one concavity is there, this depressed area, and that is called sella turcica. And this fossa is called pituitary fossa for the lodgement of the pituitary gland, and it is bounded anteriorly by anterior clinoid process and posteriorly by posterior clinoid process. Then it is the dorsum coeli backwards. So below the sella turcica, this translucent area, this is the sphenoidal air sinus. And this radiopaque area is the mastoid process, and some black area is also there, and they are the mastoid air cells. This one is the mastoid process of the temporal bone. And if you are asked, what is this bone? Is the axis, and from the body, the dens of the axis, it is directing upwards, and all these are the intervertebral disc. If you are asked what is the constituents of the intervertebral disc, your answer will be centrally nucleus pulposus and peripherally annulus fibrosus, and it is a secondary cartilaginous type of joint or symphyseal joint. Then what a radiolucent area you can see? I told you this is a frontal air sinus, this black area, it contains air, and I also told you this is the sphenoidal air sinus below the sella turcica, within the body of the sphenoid. This is the sphenoid bone, body of the sphenoid, and this is the orbit below the frontal air sinus. In the another view, we will see more clearly the different pharyngeal air sinuses. But in this X-ray, what we can see other radiolucent area. If you go downwards, here you can see this is one black areas. This one. So what is this area? This area? This area, it is the epiglottis. This one. And epiglottis is one of the cartilages of the larynx, and if you put this marking here, This is the laryngeal cavity, this one. So this is the oral cavity, this is nasal cavity coming in this way, then through this inlet it enters into the laryngeal cavity. So this is larynx, and posterior to the larynx and in front of the vertebra, this is the position of the pharynx, this one. So pharynx and larynx, and it is epiglottis. I will show you paranasal air sinuses in the another view, and that view is the occipito-mental view or called Waters view. You see here, what you can see here, this view, first of all, I told you it is a occipito-mental view or Waters view. This view particularly is taken to see the different paranasal air sinuses. The term paranasal means all these sinuses or air sinuses, they are connected or communicated with the nasal cavity, and they are situated around the nose. And this is the nasal cavity, this one, and in the midline, this is the nasal septum. Nasal septum is formed mainly by two bones, perpendicular plate of ethmoid, and from the lower side the vomer, the main two bony components of the nasal septum, which divides the nasal cavity into right and left half. So what is this paranasal air sinuses? These air sinuses, all these are air sinuses, they are the mucus lined air containing space within the bones, and so all these air sinuses, they communicate with the nasal cavity, and all the sinuses are bilateral in position. That means they are present on both sides. Let us see what are the sinuses. Before that, you see this one. This is the orbit, which contains the eyeball, this one. And these two are the frontal air sinus. This frontal air sinus, more or less triangular in shape and present above the medial part of the supraorbital margin, and it is length and breadth in all sides. It is triangular, so in all sides it is about 2.5 centimeter on each side. But the both sinuses may not be equal in size. One sinus may be in rare cases absent or partially developed, and this air sinus, it is not present at birth. It starts to appear after 2 to 3 years, and it gains in maturity after 7 to 8 years, and at puberty it gains its adult size. And this sinus open into the middle meatus of the nose. Then come to this sinus. This is called maxillary air sinus, and this air sinus present within the body of the maxilla of both sides, and it is the largest air sinus, also called the antrum of Highmore, another name, and it is the only air sinus which develops in the 4th month of intrauterine life, and it is the first paranasal air sinus to develop, and its dimensions vertically 3.5 centimeter and anteroposteriorly also 3.5 centimeter, but width or transverse breadth about 2.5 centimeter. But these dimensions may vary, and these become hazy during the inflammation of the sinus. And another sinus is there between the nasal cavity and the orbit, these black areas. This is called ethmoidal air sinus. There is one ethmoidal air sinus. These ethmoidal air sinus, they are present within the labyrinth of ethmoid, and these sinuses are completed by the surrounding bones like frontal, maxilla, and lacrimal and sphenoid bones, and number of ethmoidal air sinus on each side about 3 to 18, and they are divided into 3 groups: anterior, middle and posterior. The anterior group, the number of ear sinuses, maybe 3 to 7, and in the middle, maybe 1 to 7, and posteriorly, posterior sinus 1 to 11. Anyway, the total number of ethmoidal ear sinus, including anterior, middle and posterior, about 3 to 18. Anterior and middle ear sinuses, they open into the middle meatus of the nose, and posterior ear sinuses, they open into the superior meatus of the nose. Then come to the sphenoidal ear sinus. I have shown you in the previous lateral radiograph. I will show you once again. Before that, you complete this one. This is the zygomatic arch, zygomatic bone, and this is maxillary ear sinus. This is orbital cavity. So this is zygomatic arch of both sides, and these are mandible here, and the teeth, and here foramen magnum. You can see this one, and here the oroidal process may project into this. So these are the main things, or main ear sinuses can be visible. And besides this, in the nasal cavity, the lower part, you can see another radio opaque shadow. This is called inferior nasal concha or inferior turbinate. So once again, I am showing you the lateral view to show the sphenoidal ear sinus. Already I have shown you this one is the sphenoidal ear sinus, and these ear sinus, they are present within the body of the sphenoid, and the sphenoidal ear sinuses, they open into the sphenoid-ethmoidal recess, and that recess is present within the nasal cavity, in the upper part of nasal cavity. All the ear sinuses, sphenoidal, frontal, maxillary and ethmoidal, they are bilateral in position, and of which the maxillary and ethmoidal, these two sinuses, they present at birth, and frontal sinus appears few years after birth, and all the sinuses, they open into the nasal cavity, because these sinuses, they are nothing but the diverticulum from the nasal cavity as the mucus lined air sacs inside the body of the different bones. If you see this X-ray, this is also lateral view. Here mainly I will show you two important things. The arrow mark is given, and this one you already know, this is sella turcica. This sella turcica, it well visualized in the lateral view, and this opening here, it is opening for external acoustic meatus. The arrow is showing the opening of external acoustic meatus, and other things you know from the previous lateral view of the skull. And besides these two views, lateral view and the OM view or occipito-mental view, another view is there called postero-anterior view or occipito-frontal view. So I will show you that one also. This X-ray is the occipito-frontal view or postero-anterior view of plain X-ray of skull, and in this view we can see the structures which are bilateral in position in a very clear way, but in the lateral view we see these structures which are superimposed one on the other. In this particular X-ray, you see the sagittal suture, you can see the frontal sinus, air sinuses on both sides above the medial part of the orbital cavity, and below which the two orbital cavities, one on each side, which contains the eyeball, and you can see in the midline the nasal cavity, which is divided by the nasal septum, which is a radio opaque area, and then we can see on infralaterally of the nasal cavity the maxillary ear sinus, one on each side, and we can see also some other radio opaque areas in this view of the skull. So more or less the structures we can see the lateral view and anteroposterior view are same, but the superimposition is there in lateral view, but here there is no superimposition, and some special features we can see in the posterior view, not in the lateral view. So both are required to identify or to see the different structures of the skull in a plain X-ray view. So that's all for the post-anterior view.